Hello, good evening. How are you? How you day? I believe you can hear me, Abby. How far now? Okay. So today na Sunday and the time is 8 p.m. Now I know say maybe you they look like waiting they happen. No vex. It get how the matter be. Today's live session a question and answer session. And we won't take your question. So any question will you get for me tonight, any question will you get, just feel free, ask me, and I go answer you. But before I continue, I want me you share this live, hmm? Share the video, share this video, invite your friends. My name is Dr. Frederick Unubohai. I'm a licensed medical doctor, and I'll be the host of the program. My co-host now Dr. Israel. So if you get any question for me today, I beg, drop your questions. But remember, we know they give medication for here. We know they treat online. We know they give number. We will just teach you and advise you. If you get any medical problem, I'll always beg you, may you follow your doctor talk. So good evening and how are you? Can you hear me now? Oh yeah, talk to me. You they hear me? Let's go. Who get question for me? Let's see. Alpha, how far? How are you? Yes. Good evening, Rekbene. Rekbene, good evening. How are you? Lucky, thank God. Lucky, good evening. Lucky, how are you there now? I see you. Oh yeah, share this video. So, do we have any questions? Anybody get question for me? If you get question, oh yeah, ask me. Ask. Agnes. Agnes, good evening. How are you? Okay. Yeah. I hope you did hear me, Abby. If you can hear me, say yes, I can hear you. Oh yeah, let's go. Say yes, I did hear you. Share this video. Okay, you can hear me. Okay, Boss says, good evening, George. Boss says yes. Simfon Matthew Udose. Good evening. How are you? Oh yeah, now. Oh yeah, ask me. Ask me any question when you get any medical question. Dr. Israel is coming very soon. So when he come, we go answer your questions. I can hear you. Nice. Oh yeah, let's go. Talk to me. Yes, I did hear you, sir. Sulaiman, good evening. Okay, before I continue, anybody will want join my private telegram. Hmm? If you want to join my private telegram, look for the link on this page. Subscribe and join. When you subscribe and join, I go fee answer you. Kayode, good evening. Is it true that prolonged high blood pressure can affect the kidney? Okay, very good question. Now, Mr. Kayode, uncontrolled high blood pressure can affect the kidney. So if somebody gets high blood pressure and they no control them, if it affects the kidney, as a matter of fact, it they among the causes of kidney failure. So if you know, say, you get high blood pressure and your high blood pressure they controlled, you don't need to panic, you don't need to cry or bother yourself like that. That is why we always encourage you, say, if you get high blood pressure, always speak with your doctor, and ask your doctor questions so that they will fit help you and answer you. Good evening, Mary. I can hear you. Please, I have question to ask. Okay, go ahead. Ask your question. Dr. Israel is in the house. Yeah, let me bring up Dr. Israel. Dr. Israel, are you ready? Do like this. Give me a sign if you're ready. Okay. Let me bring up Dr. Israel. Dr. Israel, good evening. How you there?
I'm fine, though. Good evening.
Yeah, well done. Welcome. Okay, ladies and gentlemen, so we have Dr. Israel in the house, and we'll try to be very fast with your questions. Somebody's asking a question. He said, good evening, please. Your best drug prescription for blood pressure. Dr. Israel, respond quickly, I beg.
You said what?
Best drug prescription for high blood pressure.
Okay, the best drug prescription for high blood pressure now to for you to go hospital, go see your doctor. So that's the best drug prescription. So when you reach hospital, the doctor will see you, he will check you, give you the medication, and any medication when the doctor give you is the best drug. But if you they react to any of them, you go back to the same doctor. You go change them for you. And if you don't dey notice say you dey control your BP and your BP dey normal, don dey normal, you go also need to go meet the same doctor. E go regulate the dosage for you as well. So the best thing we can tell you, the best drug is for you to go and see a doctor.
Yeah, thank you. We know they give drugs for this page. We don't prescribe drug for people online. Moses, Dr. Israel, Moses say, good evening. I am a multi-drug resistant TB patient. I have completed my 6 months medication, but still coughing. What should I do now?
If you be TB patient, multi drug resistant patient, sometimes most of the treatment is more than 6 months. So you need to meet whoever they give you the medication. And now you go tell ask this question what you should do. Not be waiting you come dey ask for online. So it is the doctor that is giving you the medication. Now you go meet, whether they go do other investigation for you, or whether they go test you again to even see if you still get the TB bacteria or not. So Moses Musa, please go back to your doctor, go back to the hospital so that they'll re-examine you and know what to do for you. Thank you.
Yeah. And as Dr. Israel has said, your treatment fee day longer than 6 months. Do you understand? Your treatment might be more than 6 months. So please speak with your doctor. My cycle length was 36. Should I be worried?
I don't think you should be worried because the normal cycle length is between 25 to 35. So if you're having 36, it's just a little one above the normal that we know. So the highest thing you do, if you think that they worry you for mind, your mind they worry you for mind, you can actually go and see a gynecologist, and so that he can talk to you, encourage you, and so you feel the relief. But I'm not sure saying that's something when you go they worry yourself about. I don't think it's something you should worry yourself about.
So this person will ask us question. He ask a follow-up question. So make I just respond. He asks, could that be the cause of my fibroid? How do you know say you get fibroid? Who they manage you? Because this question where they ask us now, 36 days cycle, Dr. Israel has answered, you don't need to panic. But if you feel say you get fibroid, and that one is something totally different, you don't need to start panicking. Many women get fibroid and they are living their life. They are living well. They don't born pikin. So we cannot really tell you because we don't know uh, how your fibroid be. We don't know the size, many other things. You understand? But based on the length of your menstrual cycle, for now, because of the information where we get, we go tell you say they worried. But if it don't they happen to you like this for a long time, then please see a gynecologist quickly. Make them check you. Yes. Okay. Um. Let's see. Good evening. Good evening. Let's see. Please, I want to ask. Okay, no, 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 no. We have a question here. Please, what can make someone to be having sore throat every month, like after her menstruation?
Okay, if you always get sore throat every month after your menstruation, if you can prove that it's really after your menstruation, maybe it can just be one of the signs that is following your after menstrual issue. Um, so I don't think I'm not sure saying that's something when you two need to the warriors. It just like some people when be say before they are circled that they get waist pain, get one pain or the other and all that. And so after the meds, you not go see the pain again. So if your own is they come like that after every cycle, and you notice say after every cycle, you dey always get that sore throat. And you may not you feel not worry yourself, but you can still go further to check Is it related to your cycle, or if not something else on its own? Because the sore throat can just be something else on its own, but it just be like say can they come during that period. So you can actually go to the hospital, make them check you, do some other investigation to find out if you get anything related to your the area when you take the breathe, or the area when you take the swallow, so that you will know whether you need to worry yourself or whether you don't need to worry yourself.
Yeah, thank you, Dr. Israel. And to add to this, I uploaded a video on sore throat. Agnes, there's a video on my page today on sore throat. Please, Agnes, go and watch that video. I uploaded it today. And please, I beg, make you share this live session. Ladies and gentlemen, share this live session. If you know say you don't share, comment I have shared, and we will answer you. But if you know say you no share, don't comment or we will ignore you. But yeah, everybody share, share, share. I notice I have been urinating frequently. What could be the cause?
So many things dey when they cause frequent urination. One of them are if you dey drink water too much. If you dey drink a lot of water, you're bound to dey urinate often. So if some people wey get when they get too many sugar for their body, they feel they urinate often. Then another thing, the kind of some drug they when person go take, if it make the person they urinate often. Infection also fit make the person they urinate often, always. But there are other things when you need to know during those urination before you can actually pinpoint wetin really dey cause this my urination. If e be say you dey drink, as I earlier said, if you dey drink too many water, you are bound to urinate all the time. Now if you be say you dey urinate and the urine no dey pain you, no other thing, you fit go check your sugar level and for you to know whether sugar don dey your blood. Also, if you come be say you get any medication when you dey take and you notice say na anytime you take that medication na make you dey urinate, it can just be that medication na dey cause am. So na make I tell you say there are so many reasons when fit make you dey urinate. If you no fit prove any of these reasons, then you go see your doctor when go do some urine test for you to see if there's anything when they make you the urinate as well.
Mm. Yeah, yeah, yeah. And in addition, again, make I add, if you know say this thing where you dey complain, it don't they do you for a long time, and you shouldn't be on the internet. You should be at the hospital. You understand? And the other one, Dr. Israel has also said, I beg, try follow the advice. But if this complaint has been happening for a long time, the best answer is please see your doctor. What is the cause of internal chest pain, doctor?
Okay, Dr. Fred, answer this one.
Okay, thank you. Internal chest pain can be caused by plenty things. Plenty things. May I shock you? Sometimes you can have internal chest pain just because of your mental state. You can have internal chest pain from your lungs, from your heart, from your ribs, from fall, from accident, from infection. So if somebody they get internal chest pain, we need to know many things about this chest pain. When it starts, where it starts, wetin you dey do where it starts, how many times they do you. It go guide us to know wetin dey cause your chest pain. So internal chest pain is not, there is no way we can really even point wetin dey cause am, because there are many things in the chest wey fit give you internal chest pain. So we cannot tell you that this is why you are having chest pain, because it can be caused by plenty things. Yeah, you understand? Yeah, even weather fit give some people chest pain. So for your matter, we don't really know when it start and many things, and that is why if this pain they happen to you, we go always advise you see a doctor so that may dem check you, because we don't want to play with your symptoms on the internet. We don't know how serious it be. May we not go tell you say na small thing, whereas na severe problem dey for your chest. Yeah. Good evening, doctor. Is staphylococcus transmittable, and what drugs can one use for it? Dr. Israel.
Okay, I think we've talked about staph before, so there are different type of staph. Um, we establish the fact say staphylococcus, and unless the day where they're not supposed to, now that they fit cause infection. And if they dey where they suppose they no dey cause infection, because they are present in everybody's body. They are present in our body, everywhere for our body they dey. Now let's say when they come go where they not suppose dey, na dey fit cause problem. So infection, sexually transmitted infection can be transmitted. Um, then urinary tract infection is not transmitted. So there are some infection that is transmittable, and if they can't culture or they can't do test, they can't see say na staphylococcus na cause the infection, you know say maybe it's overgrowth or is not e go dey where e not suppose dey, because most of the time you may not even see staphylococcus for those region causing problem. So if you dey think of the medication when we go give you, sorry, we no dey prescribe medication for this place. You will need to go and speak with your doctor, who will take you through some various investigation to be sure that yes, you really get anything concerning staphylococcus, or maybe na other bacteria na dey cause infection for you. So I think na that one you need to do, to make you know your thing say na staphylococcus, staph, and staph just dey you, no dey do you anything.
Yeah, thank you. Make I talk this one again, abeg. We know they give medicine for this page, especially for the new people wey just dey come. We not be those kind of doctors where they share medicine for internet. Our job here is to teach you. Our job here is to educate you, not to come and be treating you on the internet. So if you have any medical problem, we always beg you to go and speak with your doctor, not to be asking us for medicine, because no matter how much you beg us on this live session, we not go give you medicine. So that let's be on the same page. Yeah. Doctor, please, what can cause low blood pressure? Mr. Wilson. Okay, I don't make video on low blood pressure. I don't do video, it's on the page. Low blood pressure is not that common, but it can happen. And when it does happen, we really want to find out why it happened. Is it that you get electrolyte problem? Is it that you get cardiac problem? For some people, low blood pressure is even normal for them. It's normal. We know they panic. So you need to be sure when you say I get low blood pressure, who is making that diagnosis for you? Because it get patients where we go see the blood pressure is looking like it is low, but it's normal for that particular individual. So for you right now, who is making this diagnosis, and where is this question coming from, so that you don't just be saying that you have low blood pressure whereas you are fine. Here you get. So is there anything to add?
No, I think you said it all. So
Okay.
if your blood pressure dey low and e no dey trouble you, I don't think you should worry yourself about it. You not get low blood pressure.
Yeah. So we have a question from Gabriel. Why do I feel a worm walking around my body? It's so painful when the worm gets to my chest.
Oh, okay. And I think make I not just talk too much. I don't want to talk too much. What I would tell Glory Gabriel to do is to go to the hospital, see a doctor, so that they will examine you very well. Because most of the time, wetin you think say na worm may not just be worm. Worm fit no just dey waka for your body at all. It can be that there are other things wey just dey happen to your body when not be worm at all. So that is why you need to go to the hospital, so that they will carry out a good physical examination and investigation for you. Fit just be your mindset sef na dey tell you say worm dey waka for your body, whereas nothing dey waka for your body. Fit be any other thing. It can just be a tingling sensation, neurological issues and all that. Now you dey feel and you think say na worm dey waka for your body. So the best thing is go hospital, see a doctor who go fit examine you, tell you what really dey happen for your body, whether na worm or not be worm. But I assure you, I don't think anything like worm dey waka for your body.
Yeah. To re-emphasize, no be worm they waka for your body. But in medicine, we never say never. We never use the word never say never. But most people go talk saying a worm they waka, but in most cases, no be worm they waka for your body. So If it be neurological issue and other things, and so please make an appointment with your doctor quickly, make them check you. And since you talk, say chest they pain you when you waka go your chest, it means that you need quick examination. I beg. If you never share this live session, why? Why you never share? Why are you asking us questions without sharing? Why? 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 Share the live session. Dr. Israel, somebody is asking us the analog and digital device, which one give accurate result when used? I asked this question because someone told me the analog is better than the digital machine.
Okay. The two they measure BP. The only thing is that all of them get their advantage and disadvantage. So normally we not dey quick they say this one I better pass this. It now depend on who they use and how it they use am. And so for the analog, it depends on the skills of the individual. It depends on how the person take dey hear the sound of wetin dey move, because na person dey hear am, na wetin e hear na im talk say you get. Sometimes if you never hear am clearly and you talk say you get something, so there are some errors as well when you follow the analog. Then for the digital, the battery fit weak, and when the battery weak, e fit give you wrong results. So that's the fear about the digital. But the digital is very easy to use. Anybody can actually use it. Anybody can use am when they just teach them small. But for the analog, e no be like that. That analog, you need a good teaching to be able to use that analog. You need to know how to listen and every other thing before you use the analog. So it's just about the usage of the two. It depends on the person when they use am. And two, for the digital, if the battery weak, if na battery you dey use, if e weak, e fit give you wrong result. But if the battery is a new battery, e go still give you the correct result. And also e still depend on you in person, um whether you follow the procedure of where they take am. Because when they tie your hand, they say don talk. Are you talking? So if you talk, you fit alter the result, because sometimes in the digital, once you are talking, when they check am, e go just show you error because you no fit read am. But for person wey dey lis ten, e may be able to try to pick, but your voice fit still dey echo for your ear as you dey lis ten, and e may even give you wrong result. So there's no one wey you go say na this one better pass this one. You cannot just rule this one out or rule this one in. No, that digital come in play to make work easy for us. And when you have a lot of patients, so they do that analog, e go take time and e go waste the patient time. So to make work easy, na digital come. Another reason na be say because they know say people suppose dey dey house dey test by their self, to check by their self. That na another reason why digital come as well, so that people can actually test their self without stress. And for the analog, we know say there's one wey they call mercury type. When you get mercury, the mercury inside, if e break, the mercury can be poisonous. So to avoid all those things, that's why all this digital one come out. So if you get the digital one, use am so far your battery no weak, e go give you correct result. Or if you even use light sef, e go give you correct result. If you get the analog and the person wey dey use am for you, you trust the person say e sabi read, e sabi understand the readings wey dey come out for the BP calibrator, it's also very good. So but that analog get a lot of technicality more than the digital.
Thank you, Dr. Israel. Doctor, do male take clomid? Yes, in some cases, male can take clomid. In some cases, when prescribed, in some cases, not in all cases. Huh? That is why you need to speak with your doctor. Not in all cases, but a man can take it depending on the depending. But this is why you need to get guidance from your doctor. Please, doctor, can a diabetic patient sustain injury? The answer is yes.
Diabetic,
Yes, yes.
yes, anybody can sustain injury. Anybody can sustain injury. As far as a human being, can sustain injury. So whether you get diabetes, it not change you from being a human being. So you can sustain injury.
Okay. If you are just coming, I beg. We have many questions before you, so try to wait. And we try to answer as much as we can. But no forget, share this live session, invite your friends, and we will try to respond to you. Good evening, Doctor. Happy Sunday. Um, Annually, what does H. pylori test positive mean? What it means is that they tested you for H. pylori and they found out that you had H. pylori. Full stop. H. pylori is one organism that is known to be the major cause of peptic ulcer disease. An organism. There are other causes of peptic ulcer disease, but Helicobacter pylori, H. pylori, 9B on the first on the list. So for some people, if the doctor feels say maybe they get ulcer, they like test them to dey sure whether they get H. pylori. However, in addition to wetin I tell you, no be everybody wey get H. pylori dey get peptic ulcer disease. So because say you just see H. pylori for somebody, but e no be say this person must develop peptic ulcer disease. But for most people wey get peptic ulcer disease, if dem test them for H. pylori, then they see H. pylori there. So that is what the test mean, and we could advise you also discuss more with your doctor if you get other concerns. Please, what is the cause of itching with small rash, Dr. Israel?
What's the cause of itching with small rash? Depends on the kind of rash. So when you dey see rash like that, most of the time we go advise you go see dermatologist, doctor wey dey specialize in skin. Some fit just be heat rashes, mostly when you dey area wey dey very hot, you fit just get heat rashes, develop heat rashes. So and heat rashes comes with small rash and is also itchy, and mostly when there is heat and all that. So it now depend on what kind of rash. You know, we not dey see the rash, so we cannot even talk say this one na the rash, this one na wetin cause this particular rash, or this one na wetin not cause this particular rash. So most of the rash, most of skin lesions are either caused by bacteria, it can be caused by bacteria, can be caused by fungi, and also can be caused by viruses. And some can just be allergy reaction, allergy, and na some fit still be. So when you dey see rashes for your body, dey inch you and all that, and you need to just see a dermatologist, doctors that are specialized in skin, so that make it really tell you what kind of rash is this, whether na the one wey you need to worry yourself too much, or na the one wey you not really need to worry yourself too much.
Yeah. And rash can happen to anybody. Anybody can develop rash. Do you understand? Anybody fit get rash, and rash can happen in any part of your body. So follow Dr. Israel's advice. We have one more question. Doctor, I was diagnosed with a kidney stone. They prescribed tablets for me. I almost finished 2 bottles. But what? But what? We can't even seem to get your full comment. But what? Uh, okay, doctor, please talk about HSG scan.
Okay, HSG scan na one scan when they dey do for women, mostly when they dey think say they get blocked tube. Mostly women in reproductive age when they look for pikin. Majority of those people now they could do HSG scan for. So the scan, they go it's a specialized kind of scan to check the patency of the tube, to see whether all the part of the tube they patent. When I mean patent, they open, when egg fit pass, sperm fit pass, or whether any part of the tube or your womb, anything within that womb area, whether any part they block. So that was wetin HSG scan dey check. So wetin dem dey do is to get wetin dem dey pack, pump put for inside the woman body. We dey call am dye. So they will put that for the woman body, then they will do scan. Depend on how that dye take spread for the body, now they will take know if there is if any blockage dey anywhere for the woman body. So when they don't know where that blockage dey, then they go come know the kind of treatment when they will give this woman. Mostly, as I earlier said, na women wey really wey dey look for baby, now that they quick do HSG scan for.
Thank you, Dr. Israel. The person we ask us about kidney stone It says, but I'm still feeling pain under my left pelvic region. It's still paining me, and if I touch, I feel something down my pelvic area. Can you show me another prescription for a kidney stone?
Okay, let's assume say this person a new person. So I think we will re-say it again. For this our platform, ask the doctor when we they do every 8 p.m. to 9 p.m. on Sundays. We know they prescribe medication for this place. We know they even make diagnosis for here. Because we know they make diagnosis, now make we know they prescribe medication. So that nobody we get license to do it, but our license not say make we come dey do am online. So the best thing for you is to go and see a doctor that has specialized in kidney and all those, that's nephrologist. See them. Now that person now go come prescribe medication for you. You may never give you medication. It can actually tell you other things when you go need to do. And you'll be surprised that maybe it's not only kidney stone you are having, there are other things. And so you go and see your doctor. It is wrong. It is actually 100% wrong to get prescription online and go and buy it from any pharmacy, because if anything happen to you, you no go see who you go cry go meet. At least if you have a doctor, say na doctor prescribe am for you, if anything happen to you, you go meet the doctor back, so that the doctor go see the reaction and know what next to do for you. Dis one na reason why most persons in dis part of the world dey get problem upon problem. And dis is why also all dis antibiotic resistance don dey full everywhere, because of this kind prescribe for me, prescribe for me, prescribe for me, when you may not even need them. So please see a doctor physically, so that una fit talk.
Okay. We have so many questions here. Oh. Let's see. So many questions. If you are just coming, you're welcome. Good evening, doctor. Please, can two people who are in a relationship with hepatitis B get married?
Yes, they can get married. They can get married, even though one even get, the other one not get. The other one just need to go take the vaccine, and they can get married. They can get married and they can give birth to children. The only thing is that when they give birth to children, they need to let the doctor will need to know, and if there's any prophylaxis to give to the child, they will give to the child in terms of with hepatitis B management. Because every condition get in own way when they take the manage. And so in terms of hepatitis B management, if there's any prophylaxis for the pikin, they go actually give the pikin. But yes, they can actually get married without stress.
Okay. Yeah, if you are just coming, you're welcome. Share this live session. Let me say this. Let me say this quickly before we continue. If you want to put adverts or you want to sponsor this program, send an email to the email on your screen. You understand? If you want to put an advert on this program or you want to sponsor this program, send an email to the email that is showing on the screen. And we will take it up from there. Thank you very much. Okay, let's take more question. Um, Doctor, sometime I used to feel so hot in my body. Even when another person touches me, I feel the hotness. But the person that touches my body don't feel the hotness.
Okay, that means say e be like say they get internal heat, according to what most of us used to say, that they have internal heat. Sometimes your body can be hot inside and it's not coming out. You're not feeling it, that you get any hotness outside. Yeah, if you dey feel all those kind of things, and you are okay, most of the time the weather can actually do that to you. The kind of food you eat can do that to you, and your thinking, your mindset can also do that to you. So if you can actually see a doctor and see if there's any problem. But most of the time, I can assure you that you don't have a problem. You don't have a problem. Just continue your life and don't stress yourself.
Is it true that not all fibroid grows?
Well, the answer to that is not 100% true. All fibroid grows, but it depends on the favorability of that of where the fibroid is and the age of that person when you get the fibroid. Yeah, there are some fibroid can just be there and they are not doing you any problem. They are, even though they are growing, they grow very little by little. While some can grow on time. And we also, as I earlier said, depends on the age and also depends on the kind of things you are also taking. So there are some things you may be taking and make your estrogen to produce a lot of estrogen, and that can actually feed the fibroid and the fibroid will grow. So for women wey don almost dey near their menopause, fibroid may not grow too much because those hormones wey you see dey make fibroid grow don dey reduce, because the hormone wey dey make fibroid grow na still the hormone wey dey make woman dey give birth to children. So if you within that childbearing age, some people's fibroid can naturally grow more. But after that age, when you don dey near your menopause, the fibroid may even be shrinking to some extent. So it's not like it's 100% true, but it can happen.
Doctor, my stomach used to make noise. I don't go to toilets as I used to. When I'm hungry, my stomach starts making serious noise.
It is your intestine that is making noise. So mostly the small intestine, when it's moving, it makes those sound. And when things are passing through, it also makes those sound. So most of the time when you dey get all those sound, either when you dey hungry, abeg go eat. When you eat, the sound go reduce because the stomach is trying to look for something to do. And that's why it's moving and you are not giving the stomach food. So go and eat. When you eat, the sound go reduce. So don't worry yourself too much. Some of those sound are not bad.
Let's see. Okay, no, let's see. Dr. Lawal said something. What many people call warm is usually bowel sound. Yeah, yeah. Let's see. Good evening, doctor. Please, anytime I take my bath, my body used to itch me. What causes this heat?
So there are some
So
people that have that kind of
go ahead, go ahead.
okay, Dr. Fred. So there are some people that have that kind of complaint that once they take their bath, their body used to inch them. Most of the time, it simply means that you are reacting to something. Either you are reacting to the water, or you are reacting to the sponge you are using, or you are reacting to the soap that you are using. So most of the time, those are the things you may be reacting to. It is now left for you to find out what you are reacting to. And when you are able to change those things, uh, that 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 itching will stop. In most cases, if you are using cold water and you notice those itching, just change the water to warm water warm water, hot water, and you go notice say the itching go stop. Some people, if they use sponge, they don't use am for a very long time, they go even notice say their body go dey itch dem. Even towel when dirty, some people fit still dey react to it. And also if you be say you just need change environment, and the water you don't even understand the water, it can also cause those itching. So those are allergic reaction. It means that you are allergic to something. So find out what you are allergic to and try run away from the thing or change whatever it is so that you will not get those itching again.
Yeah, thank you so much. And also, you can go to my YouTube. I also made a video and provided other things that you can do that can help you. If your body they scratch you after taking your bath, get video where they YouTube where I don't make on this same topic, so you can watch it, and there are other things you can see there that would help you as well. Other advice. What is the work of liver care?
What is the work of liver care?
uh,
I don't know. What is liver care?
I don't know where you go see that one. They carry come ask us. So make it not be like to say we no read your question. That is why we had to read your question. But we don't know where you go carry liver care from. We don't know who give you liver care. So we can't come and be telling you about medicines. Huh? Uh-huh. Why are you taking liver care? Who prescribed liver care for you? These are very important stuff that you need to know. You can't just be taking medicine. You need to know why you're taking the medicine, who give you the medicine, what are the side
Now
effects
the
of the
thing is
medicine.
that Dr. Fred, wait to the first thing now you assume saying I meant you. Now you assume saying I meant you. The person need to let us know that medicine, liver care, not medicine. Because now you assume saying that medicine. It may not just be
Yes,
medicine.
sorry. Liver, yeah, you're right. You're right because I'm already assuming it is wrong. So help us. We don't even know what you mean by liver care, really. That was true though, so that we feel know how to respond to you. Because I don't already they assume, which is quite wrong. Okay. We can't see your questions. And this is my current blood pressure check 109 76 86. That is not how we report blood pressure. Um, that is not how we report blood pressure, honestly. But Dr. Israel, do you want to comment?
Okay, yeah, that's not our. I believe this person use digital speak to measure the blood pressure. I believe because it's showing both the blood pressure and the pulse. That's what it's showing there. Everything that is there, they are good. Eh? Let me just whatever the diastolic be between the two numbers when you put for there is still within normal range.
Yeah.
So that's why I said it's good. I don't know if it's 70 something that is your diastolic or the 86 there. That's your diastolic. But any of them that's the diastolic. I know the up one is the systolic, the 100 or something. That's the systolic. But the down one, I don't know which of them is your diastolic because it's one of them that is your diastolic. One of them is your pulse. It's your pulse. So anyone that is the diastolic is also okay. So it simply means that your blood pressure as at the time you check it now is fine. It's fine.
Yeah, yeah. No more questions. We are not seeing your question. If you want to join my private Telegram, you can subscribe to join my private Telegram. Not before everybody. Oh. I get some people there. We they go live there. I they speak with them. So if you want to join my private Telegram, look for the link and subscribe. We know they do private chats for social media. We know they give anybody our number. So nobody go private chat you. Because we are very busy. That is why we did here to answer your question. You can drop it here and we go try answer you. But if you define number to call, I'm sorry, we no go give you a number. Dr. Israel, I can't see any more question here. Oh.
Okay. I may say we don't answer all the question when everybody bring come out for us to answer. That's the thing. I want to thank everybody when send question. Your question, we never take them for granted. For all those person, for you, we will not answer your question because of some things when they inside the questions when is against our rules in this place. We I want to say, should I say we are sorry? Let me just say novice and novice. Next, we just want you to know, say in every page there's always a rules, and there's always a rule. So that's why we must keep to our rules and regulations. Can I get
Can I get
pregnant with a kidney stone?
a kidney stone?
I don't ask you the question. I don't ask you. So you
Okay,
answer.
can I get pregnant with a kidney stone? Well, kidney stone no go stop you from getting pregnant. Huh? Kidney stone no dey affect fertility. Do you understand? Kidney stone no dey affect fertility. So if you get kidney stone, you can still get pregnant. And this is why you need to speak with your gynecologist as well as your urologist. But kidney stone no go stop you from getting pregnant. Oh, I'm always feeling dizzy. Why are you feeling dizzy? Always feeling dizzy, then you need to get it checked because dizziness could be a sign of plenty things. Maybe you know they rest well, you are very stressed. Maybe you get problem with blood. Maybe you get problem with heart. You cannot say. Maybe you get electrolyte problem, or you get problem with your blood glucose level. So dizziness could be a sign of plenty things. You understand? And
And you know,
to tell
say,
you,
and you know,
yeah, go ahead.
yeah, and you know, say most of them, most of the time, this their dizziness when they talk. You know, it can be, it may be the what's this thing called? Vertigo. It may not just be dizziness for some persons. Yeah. So and all of them, they just say all of them are dizziness. So if you see they feel like say they feel waka, they stagger, all join wetin Dr. Fred is tell say plus all those one wey you don't mention join, and I just say make I add that one join.
Please, can you talk about human genetics? Why should we talk about human genetics? That is not related to this live session. That is you're asking for a lecture. Eh? That is a class of genetics lecture. We cannot do that here. I beg. Huh? Sorry. Boss,
Okay,
your question is
Boss Abbas, talking about human genetics for here will not benefit our population like that. And
yeah.
what we normally talk for this group now, things wey dey common and when they happen commonly to everybody, and so that make everybody for fit benefit from it. Human genetics is something very different, and it's an academic stuff which you need to be in a classroom to know, and it's not a 1 hour lecture. If you really want to talk about human genetics, it's not a 1 hour lecture. So we will not go fit talk about human genetics for this place.
Yeah. Thank you. Hepatitis, does it affect liver?
Hepa, hepa, hepatic cells is called liver cells. So when you see that hepa, that one na already liver na dem dey talk about. Hepatitis na infection, so na liver infection na be that word hepatitis. So it means that it is the liver na im dey affect. Hepatitis B, all the hepatitis most of the time na the liver na dem dey affect. So yes, hepatitis B affects the liver, and if it's not
Okay.
well taken care of, it can lead to other things, that other chronic disease to the liver.
Yeah. Thank you so much for Israel. No more questions. Oh. So please let's round up. Any final words?
Okay, I want to use this medium to say a very big thank you to everybody when they follow us and they listen to us. You they try, will not take that away from you. When you take the use your data, take the listen, and sometimes we answer your question. While for some persons we not even remember answer your questions. Um, we want to say you are trying, and we will not forget this wonderful thing when you do for us. And because of you, that's why we are here. If not for you, I'm not sure say this session, this ask the doctor for still dey go on up till this day. I know say there are sometimes me and Dr. Fred will think say make we not even come online this Sunday, but we say no, 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 no. We get person wey really wan hear something, and because of that we go we always come online. So it's because of you that we are here. And to also use this video to say, Dr. Fred, thank you for for always pushing me to say, okay, let's really do this thing, let's really do this thing. Dr. Fred, and I shall say, for the fit they come online like this. So thank you so much. Yeah.
Thank you, everybody. We always they say thank you to you. Where they come here, spend your data here. We don't take them for granted. And also, Dr. Israel, sometimes go come here, go answer many questions, and they're among the things where they help this program. You understand? Now, we could talk something. Nobody they pay us. We they do them to help our people. So we go advise you, I beg. All the advice we don't give for here, I beg. Make sure say you follow up with your doctor. We just there here to teach you and make you get good health. So we say thank you to Israel and to you for coming to listen. By the grace of God, we go there here again next Sunday. I always tell you, good life now waiting. Good life and sense. Have a wonderful night. Bye bye. Good night. Good night.
Bye bye. Good night.